Hello, in this debate today, we will be discussing telehealth technology and whether or not it threatens the future in regards to the field of ABA. Throughout this presentation today, I, Jamie Cook, will be our introducer. Our summarizers are Ariana Suma, Bailey Hepworth, Zach Dubaugh, and myself. Our illustrators, Ariana, and both our researchers and fielders are Ariana, Bailey, Zach, and myself. We'll be covering the main pros and cons of telehealth by identifying the advantages as well as the limitations and barriers of this technology. In this presentation, our main topics of debate will be behavior, technology, cost, and stakeholder involvement. The first topic will be discussed by Bailey, and it is the pro of telehealth.
When discussing telehealth, the first thing that I want to talk about is how telehealth can support behaviors. Telehealth allows for BCBAs to see more natural environment behaviors, such as in home. This is because in home, the child will see routine changes more frequently than in controlled environments, such as clinic settings. When using telehealth, training caregivers on communication and providing parent training, there is an increase in overall fidelity and engagement. Thus, the client's social communication increases. In the Makalasic 2016 study, they provided functional communication training, or FCT, and antecedent strategies via telehealth for families with a child diagnosed with autism spectrum disorder engaging in challenging behaviors. Results show that the FCT training challenging behaviors either decreased to zero or low levels. Figures 1 and 2 highlight the effectiveness of this treatment. Figure 1 depicts the functional analysis results for Lily, Logan, and Emma. Figure 2 depicts brief treatment comparison results for Lily, Logan, and Emma. FCT, DRA, differential reinforcement of alternative behavior, differential negative reinforcement of alternative behavior. When considering telehealth for a client with challenging behaviors, it is important to consider the Ethics Code 2.15, minimizing risks of behavior change interventions. This code states that behavior analysts select, design, and implement behavior change interventions with a focus on minimizing risk of harm to the client stakeholders. A behavior analyst will never consider telehealth if the client's behavior will put family members or others at risk.
The cons of behavior will now be discussed by myself. So the topic of behavior is a huge concern when it comes to the utilization of telehealth technology in the field of ABA. For instance, in terms of behavior support, some easily identifiable cons of telehealth correlate to the existence of high-intensity behavior or behaviors that can cause harm. In-person ABA services provide the option for safety care, physical intervention, or redirection in order to prioritize the client's safety. So when we're utilizing telehealth, interventionists don't have the opportunity to physically intervene when behavioral support's needed. This is also an issue when it comes to elopement, as the interventionist can no longer ensure a client's safety if they're not in the field of view. In terms of social interaction, telehealth can't support peer engagement or social programming and interventions. Although social skills can be worked on with family members or in mock scenarios, there's no opportunity for naturalistic social engagement or social interaction with novel individuals. This is an issue since social communication and interactions are criteria and deficits explicitly noted in the DSM-5 for the diagnosis of ASD. For social significance, through the utilization of telehealth, can the interventionist ensure that programming is socially significant to their client? Essentially, this question relates to the generalization of the behaviors and skills that can be challenging to guarantee when services are provided via telehealth, aka the client's home, which is a familiar and comfortable location. So at the top right of the slide, I provide a figure from a mixed methods examination study that identified clinicians' perceptions of barriers related to telehealth and ABA. This figure is called the Client Barrier Scale. It's comprised of 10 barriers of telehealth technology that were rated by clinicians on a scale of 1 to 5, 1 being extremely easy and 5 being extremely difficult. From the study, it was revealed that 61% of clinicians identified challenges with clients' engagement. Not only that, but the highest scoring barriers, or barriers that were found most difficult, according to the clinicians, were clients who elope or bolt, which was 87%, clients who engage in challenging behaviors, which was ranked 84%, and clients who are in the pre-verbal stage, which was ranked 77%. So these percentages are related to the difficulty of these behavioral scenarios when utilizing telehealth. I think it's also important to know and hear about others' personal experiences with the cons of telehealth and ABA. So I wanted to highlight two clinician statements, which were, it is harder to manage off-task behavior of clients when you are not physically present. And the most challenges came from working with clients who are almost nonverbal and have a difficulty staying engaged during virtual services. As a behavior analyst, it's essential that we follow the BACB ethics codes. So when it comes to behaviors in correlation to telehealth services, I wanted to highlight two ethics codes, which was Ethics Code 3.12 and Ethics Code 2.15. So Ethics Code 3.12 pertains to advocating for appropriate services. This means that the behavior analyst advocates for and educates clients and stakeholders about evidence-based assessment and behavior change intervention procedures. Ethics Code 2.15 pertains to minimizing risk of behavior change interventions, and this means that the behavior analyst will select, design, and implement behavior change interventions with a focus on minimizing the risk of harm to their client and stakeholders. Technology or the ease of access as a pro of telehealth will now be discussed by Zach.
Hello, I'm going to talk about the ease of access and technology and the outreach that we can have when we use telehealth. So the ethics code I wanted to first highlight is Ethics Code 3.01, which is our responsibility to clients. So it highlights that we as behavior analysts have a responsibility to our clients. So this can include maximizing their benefits and whatever is in their best interest. So this can translate to much of different things, a very broad subject, but when we can have a greater outreach when we use telehealth. We can reach people in rural areas, people that do not have access to a center. It is a growing community, the ABA, but we can reach farther with telehealth. So the big thing to talk about here is the COVID-19 pandemic. So beforehand, the ABA clinics were bustling and growing everywhere. And then the COVID-19 pandemic happened and everyone was losing services. So this is extremely detrimental to our clients. As we know, if they are out for a small amount of time, it can be detrimental for their interventions. So we go into the COVID-19 pandemic, everyone is losing services. So with the use of telehealth, we could immediately begin using those services again and reaching them just with this access, with using our technology. So, so we can reach people in rural areas. So we can provide services to people in rural areas without access to an ABA clinic that previously not have access. So if we look at the article from Pollard et al. 2021, they took 17 cases that transitioned from in-person services to telehealth services, switching that model. And the big problem that we have with telehealth that people are talking about is, can we still maintain our services? So out of these 17 cases, they all received a similar amount of therapy hours, and 80% maintained their level of correct responses or increased their level of correct responses. So it shows that this could not be an issue. They can all receive services. So when we get all of our people if they're hours away from a clinic, they can still get services. This just increases the outreach of ABA, which is very needed for our community within our children with ASD.
I will now be discussing the cons of technology. When it comes to access, cons of telehealth are the technology materials, such as access to laptops, computers, phones, etc., internet services. So does the family have Wi-Fi? And the familiarity with technology. Essentially, does the client or stakeholder know how to navigate a computer? Do they know how to navigate their email, look at therapy invites, etc.? For technical issues, internet connection can also be a con. So for instance, do they have good internet service? A lot of recommendations for telehealth are to individuals living in rural areas where internet service may not be great. Poor internet can interfere with ABA services if there's lagging or loss of connection. Also, there's possible audio and video problems, dead technology or technology that needs to be charged, which can interfere with the service delivery, and broken devices. So if a client's utilizing their laptop for their services and the laptop breaks, what does that mean for the continuation of their services? In terms of distractions, cons of telehealth correlate to the client's environment. So since services aren't in person, we can't control the environment. This can cause for distractions that can take away from or hinder the learning and progress. Not only that, but the device the client is using can also be a distractor. So maybe your client correlates the device they're using to YouTube, or a client engages in button clicking or any other technology exploration that can create distractions and lead to problem behavior or consistent redirection. I added a figure from a mixed methods examination study at the top right. It's similar to the client barrier scale. This figure is called the technological barrier scale. It's from the same study that I mentioned earlier. So clinicians were asked about their experiences with telehealth, and they rated the barriers of telehealth on a scale of extremely easy to extremely difficult. From this study, 84% of clinicians identified that technology-related challenges were a barrier to telehealth services. Not only that, but the highest scoring barriers, or barriers that were the most difficult according to the clinicians, were clients' access to technology, which was 47%, internet connectivity issues, which was ranked 38%, and clients' access to internet services, which was ranked 36%. I also wanted to highlight again a clinician statement from the study, which was, there were limitations of field of view, or I was limited to only visual and auditory stimuli. There was difficulty observing stimuli evoking client response. Connectivity issues and slight lag time also affected this. This statement just provides a firsthand example of how technology can be a con to telehealth and can burden ABA services. Ethics Code 2.19 refers to addressing conditions interfering with service delivery. This means that behavior analysts identify and address environmental conditions that alter or prevent the service delivery. Behavior analysts should remove or minimize any interfering conditions, identify effective intervention modifications, and/or they should consider recommending other professionals. Behavior analysts document conditions, all actions taken, and the eventual outcomes. This is important code to consider pertaining to technology and the use of telehealth services. So if technology is an interfering condition of service delivery, then it is a behavior analyst or the interventionist responsibility to address and alter those conditions or outcomes. Cost reduction as a pro of telehealth will now be discussed by Zachary.
Yes, so the code I wanted to highlight that pertains to the cost reduction would be Ethics Code 3.12, advocating for appropriate services. So this is when meeting with clients and stakeholders is our responsibility to advocate for the services they may need for effective treatment. If we're reducing cost using telehealth, we are able to provide more services possibly, or just in the way that if we're going to advocate that they need 40 hours or 30 hours or 20 hours, it needs to be affordable in some way. If they can't afford this, then it's not there and we're not advocating for them properly. So in the research in the Lindgren et al. Article, they conducted a study on 107 children with ASD using 3 different treatment methods. The 3 methods being in-home therapy, clinic telehealth, and home telehealth. And they all concluded in a reduction of problem behaviors with their interventions. And the biggest difference between these 3 treatment methods was just the cost. And I added a figure over on the right, and you can see it all labeled. So the staff costs across the board, the in-home therapy, about $4,700. The clinic telehealth would be $1,700, and the home telehealth being $1,200. So that's the staff cost, the facility costs for in-home therapy being $100, the clinic telehealth being 172, and the home telehealth being close to 100 again. And the family costs being a big one. This is what goes directly to the families. The in-home therapy costing roughly 1,200, the clinic telehealth costing roughly 1,200 again, and the home telehealth about 860. So this brings our total costs, the mean total cost per child over a month, being 6,000 for in-home therapy and 3,000 for clinic telehealth and 2,100 for home telehealth. As you can see with the total cost at the end, there's a huge difference. It's roughly home telehealth being roughly a third of the in-home therapy cost. This can be a huge benefit to not only the families, but also the clinics themselves. So if they are not having to shell out as much cost for therapy for each client, they're able to accept more clients, or they're able to provide different services or have better outreach. They can open up a clinic in a different area that is not currently serviced. So those are the benefits that we have there. With all of them that are receiving the correct treatment and also reducing problem behaviors, this should not be an issue. And we can get appropriate services for all of our clients.
Ariana will now be discussing the cons of cost.
Although telehealth services may be more affordable to the consumer, it can be more expensive at an organizational level and increases privacy threats to the consumer. Companies are at an increased risk for protecting client data via telehealth. When providing telehealth services, companies must comply with state and federal laws. This requires companies that provide telehealth services to be HIPAA compliant, which HIPAA compliant software and technology is often quite expensive to operate. Companies often face barriers to technology competence that increases threats to securing and protecting their clients' data. These barriers stem from an organizational level of budgets, frequency of trainings for staff, and the technical skills of their employees. In the event of a data breach, clients are at risk of losing services, the organization is at risk of losing their business, and the behavior analyst is also at risk of losing their credentials, as they are the ones responsible for ensuring that their clients' data is safe and protected. Ethics Code 2.03, Protecting Confidential Information, and Ethics Code 2.05, Documentation, Protection, and Retention of Legal Requirements and Compliance, highlights how behavior analysts protect client confidential information and highlight how behavior analysts protect their clients' information and comply with all requirements for storing and ensuring that physical and electronic documentation is safe and protected. From an organizational level, telehealth services come with additional costs and considerations. Organizations and behavior analysts must be aware of different state laws, regulations, guidelines mandating reporting, and ethical standards. This means more training and increases the risk of employers not adhering to state-specific standards. Telehealth services may not be covered by some insurances or third-party payers. Some states may not even approve funding for telehealth services. Complying with state-specific funding sources and requirements present significant barriers to organizations. Ethics Code 1.02, conforming with legal and professional requirements, ensures that behavior analysts follow the laws and regulations of the board. Ethics Code 3.05, financial agreements, highlights how before beginning services, there's an agreed upon compensation for services. Ethics Code 3.07, third-party contracts for services, highlights how when working with third-party contracts, that the contracts outline the nature of the relationship and ensure behavior analysts adhere to following it. Moreover, technology disruptions present significant barriers to providing clinical services. Therefore, organizations must budget for an inventory of HIPAA-compliant devices that are ready to be used at any clinical time. Organizations will run into problems with employees using personal devices that are not HIPAA compliant to provide services when their company devices don't work. This goes against Ethics Code 2.03 and increases the risk of data breaches. Organizations must have a system to maintain and repair equipment, have agreements for returns of devices from staff that quit or leave, a secure backup cloud, and software compliant with laws and regulations. Organizations that provide telehealth services must provide equipment and internet to those with economic disparities. Overall, organizations that provide telehealth services are at an increased risk of data breaches and a loss of confidentiality. From a consumer standpoint, you need to identify whether the cost of services or your data is a more important factor to you. Telehealth organizations should consider these costly barriers to services and disclose the limitations and risks with telehealth to consumers per Ethics Code 310, limitations of confidentiality.
Stakeholder involvement as a pro of telehealth will now be discussed by Bailey.
Another supporter of telehealth that I like to think of is the requirement of stakeholder involvement. When I think of stakeholder involvement, I think of Ethical Code 2.09 involving clients and stakeholders. In the Araba and Kalik 2023 study, when recommending ABA telehealth services, they mentioned the need to ask caregivers and clients, if applicable, if this were something they would like to consider. When discussing with caregivers, they provided clear and detailed information of what is expected and the technology they would need for a 10 to 25-hour treatment week. In this study, there was no cancellation of sessions for any clients. Caregivers attended all sessions until clients were able to set up sessions by themselves. Within this article, they also mentioned the Blissel et al. 2021 study where they attempted to increase caregiver involvement by sending session reminders 24 hours in advance and again 30 minutes before session. In most instances of telehealth, stakeholder involvement can be demanding in the beginning, but once the client is no longer in need of direct support, so this is when the client shows more independence, the caregiver involvement would start to decrease. They'd start to be back off and allow them to set up their own sessions. When discussing Ethics Code 3.12, advocating for appropriate services, behavior analysts advocate for and educate clients and stakeholders about evidence-based assessments and behavior change intervention procedures. Telehealth is only recommended to clients with specific skill sets, such as attending, prompting, following directions, sitting in front of the computer, and have a list of reinforcers.
The cons of stakeholder involvement will now be discussed by Ariana.
The success and effectiveness of ABA telehealth services relies heavily on parent involvement and engagement. This can be extremely hard and a big commitment for parents to navigate. In the same study discussed by Jamie earlier, conducted by Pomalis Ramos et al. 2023, researchers identified challenges with caregiver involvement. They surveyed 479 BCBAs with at least one client with ASD who provided telehealth services. Out of those BCBAs, they found out that 45% reported difficulties with increased distractions, competing demands, navigating conversations around caregiver expectations, and their perception of telehealth services. Throughout this study, clinicians frequently describe barriers with parents unable to attend or engage in sessions, parents having to caretake others, or they had competing demands with work and other responsibilities. Within the same study, clinicians began to notice that parents with increased involvement began to have negative perceptions of telehealth services due to increasing frustrations with implementing strategies, pace of sessions, parent coaching, tech issues, and the service modality overall. These caregiver barriers could be avoided by providing ABA services in person. For example, when perceiving in-person services, parents typically can drop off their child and come pick them up later. Parents are not expected to help and supervise throughout their entire session. With in-person services, there are fewer technology barriers. A BCBA can more readily model program and can individualize parent coaching more easily. Ethics Code 2.09, involving clients and stakeholders, highlights how behavior analysts make appropriate efforts to involve both the clients and the stakeholder throughout services. Telehealth services can create significant barriers that weaken the relationship between the behavior analyst and caregiver involvement. Moreover, when providing services in rural communities, telehealth services may impose more risk on multiple relationships and create challenges with conflicts of interest. In rural communities, there may often only be a limited amount, like 1 or 2 behavior analysts who can provide services in that area. Or there may only be one child with ASD in a rural community in which you're the BCBA of, and you may accidentally expose that you work with that child, and then now you have no longer followed the ethics code. This increases the risk of not protecting the client's confidential information. Ethics Code 111 highlights how behavior analysts avoid multiple relationships with others. Behavior analysts continuously monitor the development of multiple relationships, and they take the appropriate steps to resolve them. Ethics Code 2.01, providing effective treatment, highlights how behavior analysts protect the confidentiality of all parties involved. Providing telehealth services in rural communities can increase the risk of quality of care, professional objectivity, breaches confidentiality, and client harm. In the same study by Pomalis Ramos et al. 2023, 57% of the clinicians reported barriers to implementing ABA strategies over telehealth. These barriers included skill management, coaching parents, prompting, reinforcement, and treatment fidelity. Telehealth services rely on good vocal communication, and they limit the strategies that behavior analysts can use. For example, difficulties with communication can lead to misunderstanding, which can then lead to treatment fidelity concerns. Communication is the basis of what behavior analysts do. So having communication breakdowns via telehealth can weaken rapport with stakeholders. When coaching parents in person, behavior analysts rely on their verbal and nonverbal cues. Stakeholders' nonverbal cues can be misinterpreted through telehealth. Language and cultural barriers can be difficult for behavior analysts to navigate through telehealth. Stakeholders can perceive interventions differently than intended, or interventions may not be culturally appropriate for the family to work on within their home. Rapport with families may be hindered based on family views of telehealth. Ethics Code 2.01 highlights how behavior analysts prioritize their clients' rights and their needs during their services. This is not limited to prioritizing the client stakeholders as well. Behavior analysts provide effective treatment designed to maximize desired outcomes for all parties involved.
This is now the conclusion of the debate portion of our presentation. We just want to make a final statement for our topic of telehealth technology threatens the future. So the field of ABA is ever changing. With the growth of technology and the unfortunate circumstances of COVID-19, there's no question as to how telehealth technology and ABA has grown to become what it is today. As mentioned throughout the presentation, there are many advantages as well as limitations and barriers when it comes to the utilization of telehealth services. Overall, we feel as though the use of telehealth technology will be an individual preference and be considered on a case-to-case basis, as ABA is not a one-size-fits-all therapy. Each case will require deliberation and an individualized approach based on the resources and needs of those involved. All right, we will now be shifting our presentation to an audience-oriented Q&A in which each of our group members will be answering questions related to the utilization of telehealth technology in the field of ABA. Our first question will be answered by myself, and the question is, how does a behavior analyst ensure that a client is assenting to treatment procedures through telehealth with limited visual or behavioral cues? So ensuring assent and recognizing assent withdrawal is crucial in providing ethical and effective ABA therapy. When we're utilizing telehealth as a means of therapy, there are signs we can look for to ensure that our client is giving assent. Some possible signs we can look for include positive or negative language, such as I don't want to, or maybe a yay of excitement, facial expressions, so are they smiling, are they frowning, etc., an increase or decrease in behaviors with specific programs or task demands, engagement or lack of engagement in activities, and bodily cues, such as turning towards the speaker, turning away from the speaker, crossing their legs, or looking very tense versus looking very relaxed. Because telehealth is virtual, behavior analysts need to ensure that they're regularly checking their client for signs of both assent and dissent withdrawal. The second question will be answered by Ariana, and the question is, what do you do if you believe your telehealth services are insufficient in meeting your child's needs?
This question is geared toward the stakeholders who has a child receiving telehealth services. If you believe that the services are insufficient, schedule a meeting with your BCBA. Outline your concerns and what your goals and expectations are for services. As a stakeholder, you need to be proactive, communicate, and collaborate with your BCBA often and frequently, not when you are feeling these concerns and not when you're feeling these concerns. ABA therapy is data-driven, meaning that your BCBA can show your child's progression over time. You are your child's biggest advocate. If there's something you would like your BCBA to work on, they should be receptive and implement it to the best of their ability. If your concerns are due to caregiver involvement, your BCBA should be able to provide you with more support and training or come up with a plan. You have the right to discontinue services. However, you should be aware of potential regression in skills, increase in challenging behaviors, or an inability to acquire services elsewhere if you are in a rural area, for example. However, as a stakeholder, you need to understand the limitations and barriers of telehealth before beginning services. Telehealth services may just not be appropriate for your child and family.
The third question will be answered by Bailey, and the question is, how does one evaluate performance integrity via telehealth?
When providing telehealth services, the BCBA prefers to provide many hours of supervision within the caregivers and RBTs. When the BCBA is providing support for caregivers of all sessions, they will be checking treatment integrity and providing modeling and feedback. The BCBA may not be present for all sessions with an RBT, but when they are, they will check treatment integrity by looking at the proper uses of SDs, prompts, reinforcement, error correction, just like they would for caregivers or RBTs in a clinical setting.
The final question will be answered by Zach, and the question is, how has the use of telehealth in ABA changed over time?
So the use of telehealth in ABA has evolved significantly over time, driven by technological advancements, increased accessibility, and external factors like the COVID-19 pandemic. The early use of telehealth was plagued with issues such as limitation of access to required technology and slow internet speeds. This gave a very slow rise in telehealth in ABA. In the 2010s, we saw these issues slowly getting better, but most states were not recognizing telehealth as a viable service. So even though most households are now having internet, reliable internet, and at least one computer in the household, we're still not seeing a bunch of states using telehealth as a viable service for ABA and other health services. COVID-19 led to most people not being able to receive treatment, which ultimately led to a massive surge in use of telehealth services in ABA. By this point in time, computers were a household item and high-speed internet was becoming a standard. Insurance companies quickly began to expand their coverage of telehealth and made it possible for so many people to continue receiving their ABA services. Today, telehealth is bigger than ever and still widely used, especially for rural areas and underserved populations. So I hope to see the rise of telehealth as it brings services to so many.
All right, thanks everyone for your answers. That concludes our Q&A. So lastly, here are the references that were used within our presentation today. And thank you everyone for following along.